Okay, good afternoon. Today we'll be talking about skin allergy prick test and we'll be demonstrating to you. So usually before starting with the skin allergy prick test, you understand the history of the patient, you do the physical examination, you specifically ask for history of asthma, and you have to check on what medications the patient is on. So if he is on any antihistaminics, you need to stop them for 5 to 7 days. Any antacids should be stopped for 5 days. Any antidepressants should be stopped for 21 days. Patient is appointed. So we'll just begin with the demonstration and I'll come back in 5 minutes.
Hello. Hello. So we are going to test the different airborne allergens like pollen grains, fungi developing in all decaying materials, and the most commonest test in the India, the most commonest allergens in India are the dust mites. So we will start testing on this patient. This patient's main complaints are early morning sneezing, cold 24 whole 365 days cold. Mostly his problem is in the morning. His father was asthmatic history, but no pets at home.
स्पष्ट सांग रे.
व्हॉलीबॉल खेळायचा. त्यानंतर 7 वाजता प्रोग्राम चालू करायचा. याला जो आवडेल तो. पण आपण डीजे आणि हे काय करायचं, 300 रुपीजचे स्टार्टर, 7,500चा डीजे. रूम तर कसं आहे, तू घालून ते आपल्याला एका रूम मध्ये 5 जण.
कॉल जोड.
मग ते रूम आपण वाढवू ना.
म्हणून सांगितलं 4,500 रूम आहे बरोबर.
आणि कमी करू सर.
शक्य नाही. सर इधर येऊर पे कैंटीन नहीं तुम्हारा मिलिट्री का खाने पीने के लिए फूड बीड के लिए
नाही आहे.
उधर ही इधर कैंटीन तो है ना बाकी
उद्या सांगतो.
सर ने 93 का बॉटल लाया था मालूम है ना. 93 में अपना कॉन्फ्रेंस हुआ था बॉम्बे से लाया था. तो अभी तक मेरे पास 3 बॉटल है शोकेश में है. एरिस्टोक्रेट दे देता हूँ. अभी कितना साल हो गया, इतना पुराना हो गया था. एरिस्टोक्रेट है एक ऐसा स्क्वायर है मेरे को याद क्या क्लिनिक में रखा है घर पे. क्या उधर लेके आएंगे ना क्या प्रोग्राम है
घर पे आणि अभी सर
उसके लिए तू जल्दी करेगा प्रोग्राम.
प्रॉब्लेम हो नाही सर. किती जण येतात हा आमचा
ऑर्डर वाली
हां बोलूया. फुल आहे ना सगळं स्लाइड वाईज नाही ना बट आपण विथ फॅमिली ओपन स्पेस है. ओपन स्पेस है. ओके हाँ हाँ लेफ्ट साइड
ड्राइविंग कुछ कम है तो आपल्या जीएम साइडच आहे.
मायक्रोबायोलॉजी से लालवाणी थोडा लॉन आहे ओपन वर फुल आहे बस तो चित्र. डीजे किंवा सर किंवा आपले कॅराओके मस्त असेल व्यवस्थित.
हम लोग लॉन्ग टर्म करेंगे. एक सीटा ले रहा था. आता आमचा जीएमसी क्लासमेट्स झाला होता 72 बॅच. हां थोड़ा नीचे अंदर जाना पड़ा. हाफ किलोमीटर नहीं सर, जस्ट 200 मीटर नीचे उतर काजूपाड़ा. शादी वादी होता है. You don't have to go up to complex. No. आपका सिल्वर जुबली पे ये हुआ था.
गायमुख के बाजू में
सबका कॉन्फ्रेंस का भी होता था ना. 93 का कॉन्फ्रेंस का बैच में होता था. 93 का रेमंड्स में होता था. अपना राणे साहब चला ये एक्सपर्ट.
the allergic skin prick test.
So we have this young boy who's 21 years old, and he's been suffering since the last 6 years, gone to multiple doctors and ENTs, and finally come to us, and we are going to do his allergic skin prick test. So his routine symptoms are sneezing and itching of the back of the throat and flaring of the pharyngitis. So the technique of doing the skin prick test is, first you clean the forearm of the patient with alcohol. Then you keep a 2-finger distance from the antecubital fossa. Make 2 circles. One will be for your histamine and the other will be for saline. So histamine is your positive control, and the histamine usually gives a reaction. If there is no reaction to histamine, then you can abort the test, as it will be a false negative test. So now the sequence goes like, you mark the patient's hands with the number of allergens that you want to test for. So in his case, it is respiratory symptoms, so we'll be doing airborne allergies. He has given no history of any food allergy or any other substances. So in the airborne allergy, we'll be testing for pollens, we'll be testing for fungi, we'll be testing for dust mites and pet dander. So sequentially, we will be putting the allergen extract on the number that is assigned next to the mark, and we'll be doing a skin prick test with the use of a lancet. This is a routine lancet. Okay, नको करू headlight. ह्याचं intensity कमी करतो. Is this fine? मला magnification. I use a magnification. माझा चष्मा आणा please.
मॅडमचा चष्मा आणा पटकन.
No, this headlight is with a magnification. So, hello. So I actually use this headlight with a magnification loop. So it is more accurate, and the prick is more gentle. So you can just focus on the headlight and just show what headlight this is, and I will remove it and I'll do without the headlight if the clarity is not good.
फक्त लूप लाईट नको ना
बॅटरी काढून टाकली, बॅटरी लावलं की चालू होतं. बॅटरी काढून टाकली तर होईल.
That's the histamine. You clean it and go for the next one, line. Now with the pollens. prick, lift up and withdraw. So usually we do testing for allergic rhinitis, sinusitis, allergic dermatitis, conjunctivitis, and eczema, and people who want to test for any food allergies. Usually the test is done for children above 5 years of old. And the skin prick test, the results are within 15 minutes after putting the allergen and doing the testing. It's absolutely painless. As you can see, the patient is watching himself smiling. You can also do this test on the back if you need to do more tests. It's just a small drop of allergen that is put on the skin. By doing the slight gentle skin prick, we introduce the allergen into the skin. We always have our emergency kit ready. Patients sometimes can give a severe reaction, sometimes going into anaphylaxis. Milder reactions are redness and a wheal, a significant wheal which is equal to and more than the histamine will show that the patient is sensitive towards that allergen. Now, as you can already see, we can appreciate a good histamine wheal. So in your emergency kit, you must always have your adrenaline injection ready. If the patient complains of any lightheadedness or dizziness or breathing difficulty or any shock type of a symptom, you can immediately put the patient down and give injection adrenaline, then hydrocodone, dexa, and if wheezing present, then adrenaline, oxygen. There is also a patch test which we can do for patients who want to test themselves for any metals, people who are working in any industry for chemicals, for resins, latex for surgeons or doctors or factory workers in rubber industry, or hair dye or fragrances. So the patch test is usually the substance is placed and is covered with a blotting paper for 48 hours. Patient is supposed to keep the body dry, no bathing, and no excessive sweating. The patch test is seen after 48 hours, and if there is any wheal or redness, the patient is considered sensitive for the substance. So the other thing, other way of testing for allergies is you can do a blood test, which is not so sensitive, and it's only indicated in children. You should also check for asthma, and over here we do a PFT, pulmonary function test, and also treat them for their respiratory disorders. So after the skin prick test, when you can see the results positive for any particular pollens or fungus or dust mites or dengue, pet dengue, we advise the patient avoidance and medications to treat the current symptoms, and in severe cases we put them on immunotherapy. Ideally, patient should take immunotherapy for 3 years so as to develop good sensitivity towards the allergen. Yeah, please show the patient and the doctor also both. So you can see how the patient is sitting very relaxed, very confident. So now we'll wait for 15 minutes to see the reaction for any of the pollens or fungus or dust mites.
हाथ रिलैक्स करो, अभी रुको, इधर ही रुको, उधर वो एनेस्थीसिया दे रहे, फिर इधर आएंगे, फिर आप इधर हाथ चलते इधर कर, अरे बोल मत